Started now. My name is Travis. I'm a pharmacist with the Know Your Rx Pharmacy Coalition here at the University of Kentucky. And today we're going to go over the retiree prescription benefit. Before we get too far along, I just want to let everybody know that if you have any questions, concerns, or anything, you can type it into the chat box of the Zoom meeting. Lucy Wells is our director here at the Coalition. She'll be monitoring the chat and providing answers. If for some reason your question doesn't get answered or the presentation doesn't answer all of your questions, please feel free to send us an email. The email address indicated there on the screen. We monitor that daily and we can provide a response to you as quick as we can. So with that, we will get started. The UK retiree prescription benefit is kind of broken into two buckets. One of them is the pre-65 non-Medicare retiree benefit, and the other one is the Medicare retiree. The difference is that pre-65 group just kind of mirrors the current prescription benefit that's available to patients now. The Medicare retiree benefit is after you're 65, or if you're no longer working, up to 0.2 FTEs, and you're over 65, then you would fall into that Medicare retiree. So we'll go into some of the details. Like I said, that pre-65 non-Medicare prescription benefit really just is an extension of what you currently have. It's the HMO, PPO, RHP, EPO, the Indemnity, or the Saver high deductible health plan. It looks just similar. You have one card for you, and then your dependents, spouses would all fall underneath that same card as that same ID number. This is administered by Express Scripts. They're the prescription benefit manager. We do have direct access to enrollment. So if there's ever any issues with how your plan is set up, whether or not you have dependents on it, we can usually fix that pretty quickly with the HR shop here at UK and get those things fixed. And addressed very quickly. The Medicare retiree prescription benefit is a bit different. It's a UK Medicare Part D prescription drug plan. You'll get a new ID card, and there'll be a new ID card for you. And if you have a sponsored spouse, they would have their own plan as well. While they have their eligibility for this plan through you, your plans aren't tied together as far as accumulators or being able to see their prescriptions on just one profile. You really kind of have two separate benefits per patient. So there's no dependence on a Medicare plan. This is administered by Express Scripts as well, but there are Medicare controls for enrollment. So it's not as quick to get done. This is very important that before you go on to Medicare, that those 3 months leading up, you have all your T's crossed and I's dotted so that you have a smooth transition into the Medicare plan. We'll talk a little bit more about that later. This is an overview, kind of a quick glance at the current UK prescription benefit for active employees and those early retirees that are involved in, the continuation of the prescription drug plan before they move into the Medicare plan. So there is, as you can see in the UK prescription benefit, there are minimum copay requirements, $8 for generics. And then when you look at the retiree, the Medicare retiree, there is no minimum. So you do see kind of a difference there. You are not limited to UK or Accredo for specialty drugs. You can kind of go to any pharmacy that's willing to fill them. There are some instances where you would see a lower copay through UK or Accredo, but those are very one-off cases that we can talk about with specific patients. Copay structures are meant to be very similar, so there's not a whole lot of disruption when you move from the Medicare or from the active employee plan to the retiree plan. And we'll go over a few of the side-by-side differences here in the next couple slides. There are a few operational differences that we see with the active and early retiree plan versus the Medicare plan. 90-day supply for active employees is only available through UK or Express Scripts mail order. In the Medicare plan, that opens up a little bit more. Walgreens is included in that 90-day supply of prescription ability. There's a few other independents where there may be a situation where there's not enough Walgreens in the area to justify only having Walgreens for a 90-day supply, but this is a good rule of thumb to hold on to. As I spoke about earlier, especially medications in the Medicare plan can go to any pharmacy, whereas currently you're limited to UK or a Credo mail order. Healthcare reform, also known as the Affordable Care Act or ACA, has $0 copays for preventive medications. We see that with oral contraceptives, colonoscopy preparations. Medicare is not affected by the ACA in that regard, so there are no $0 copay medications in the Medicare plan. With pharma, so if you're getting a prescription medication, say your brand name Livalo for lowering cholesterol, you can use a copay card to help lower that cost for you. That's allowed in a commercial plan, such as the active employees or early retirees, but in Medicare, pharma copay cards are not eligible to be used. So the pharmacy cannot run a copay card secondary to help with the copay on that. There is pharma contribution dollars into your plan structure, and we can get into that a little bit later, but they do make a contribution, just not allowed at the point of sale. The UK pharmacy 50% discount, I hope as many patients as you can are taking advantage of that now. You get a 50% off your copay, up to $60 off for prescriptions that go through the UK benefit at the Kentucky Clinic Pharmacy, any of their 5 locations, and it's ordered by a UK prescriber. That discount is not available to be offered to Medicare. Like I said earlier, there are different rules that the Medicare plan has to follow. So moving on to the formulary, currently the UK plan is an open formulary. So if it doesn't fall in that list of medications, it's still covered at a 50% coinsurance. So you do receive some of the benefit. And the Medicare plan is a closed formulary. So if it falls outside of that list of covered drugs, it is not covered. It would require a prior authorization for coverage that would have to be sought out. Saw somebody had a very good question about pharma copay cards. I believe Lucy's addressed that. They are those copay cards you see on TV's commercials. You contact us to help lower your copay. It's a secondary to your current insurance. It doesn't take the place of insurance or anything like that. It's just an incentive from the drug manufacturers to help reduce your patient's copays on medications. Some drug coverage differences that we see on the active employee plan versus the Medicare plan. Diabetic testing supplies currently in the pre-65 Medicare plan, they're covered on the prescription benefit. On the Medicare side, they're covered on your United Healthcare card Medicare Advantage plan, which is a great benefit they have. They're actually, the preferred brands are One Touch and AccuCheck currently, and they would be covered at $0 at the pharmacy. So there is kind of a difference there. Nebulizer solutions, oral anti-cancer medications, those are both right now covered on the prescription benefit, but when a patient moves into Medicare, they're on that Medicare Advantage plan. Some other differences, flu, pneumococcal, pneumonia, hepatitis B vaccine. Currently, they can be covered on either side, the prescription or the medical. In Medicare, it's only covered on the Medicare Advantage plan. And that can still be billed at the pharmacy for those vaccines. You would just present your United Healthcare card as opposed to your Express Scripts card for those vaccines. And then vaccines are kind of broken out into 2 different sections there. All other vaccines are on that RX only. So your Shingrix, your hepatitis A, those would be on the RX benefit. Vitamins and minerals are a Medicare exclusion. They're not covered on a Medicare plan. I spoke about this a little bit earlier. We do have to follow Medicare rules on the UK Medicare retiree prescription benefit. So those are excluded, along with cough and cold medications. The UK Medicare prescription benefit, like I said earlier, it's administered by Express Scripts. It is a Part D drug plan, and you do not want to enroll in any sort of extra Part D or any sort of extra coverage. You can only be enrolled in one plan. And if you enroll in another plan, it could kick you out of this one. So you do want to make sure that if you're going to be in the UK Medicare plan, that you only enroll in this plan. It's subject to all the CMS, for Center for Medicare and Medicaid Services, those Part D requirements. The standard Medicare Part D benefit looks a lot like this. So very simple to understand. Everything is very clear on there. I hope that came across well, and some people are having some chuckles, but it is quite a complicated graphic that we have here. Fortunately, this is the standard minimum. This is the weakest that the plan can perform. As you can see here, a $435 deductible. And then partial coverage is 25%, and then Medicare plan pays 75%. The UK benefit is very fortunate to be able to provide something where we've eliminated the deductible. Our copay structure is as it was earlier, with percentages and no minimums, but there are maximums. So you'll never pay more than a certain amount of money for drugs. This coverage gap that's often referred to as the donut hole, where patients' coverage can sometimes drop off and they have higher cost. In the case with University of Kentucky, you are covered during that coverage gap. Throughout the year, you will only see your prescription drug costs get lower as the year goes on. You won't have this time period of coverage where things get more expensive and then you get into catastrophic. But this is just a reference point of knowing what the standard Medicare D plan is that everybody has to follow, and the least amount of coverage we can offer is this. As I talked to you a little bit earlier, there's no donut hole, no deductible, and that coverage gap is when the total drug spend, and these numbers continuously get updated. We don't have the numbers for 2021 yet. They're still pending. As you can see here, historically, 2019 was about $3,800, and in 2020 was $4,020. And that catastrophic coverage is for when your true out-of-pocket reaches a certain threshold. And we'll have an example about true out-of-pocket here in a moment. So true out-of-pocket includes your copay and coinsurance. And then previously in that slide, when I showed kind of where pharma contributes, and pharma copay cards can't be used in the Medicare plan, they are contributing in that coverage gap. So if we look down here, that initial coverage phase, let's say you're taking a drug, total drug cost is $3,000. It hits that maximum of the copay of $60. And while you're in the initial coverage phase, there is no pharma contribution from anything. So your true out-of-pocket for that was $60. Once you enter that coverage gap phase, drug cost still hasn't changed. Your copay hasn't changed because UK makes sure that benefit stays the same throughout the coverage gap through that initial coverage. But there is a pharma contribution of $2,100. You get credit for that moving into the next phase. So your accumulators follow all of that. I talked earlier about making sure that you get signed up about 3 months prior to your 65th birthday. You'll complete all the Medicare Advantage plan enrollment with UK HR benefits. UK sends the file to Express Scripts, who sends it to Center for Medicare for processing. Then once it gets approved, Express Scripts sends you a letter with a welcome packet, your ID card, and all of that stuff. You want to hold on to that Express Scripts ID card, and you want to make sure you hold on to your United Healthcare ID card. Those are the two most important pieces of information that you'll need when you're at the pharmacy, the doctor's office, if you ever need to go to the hospital or anything like that. Your Social Security number will not be the basis of how you're identified with Medicare any longer. They've switched over to what's called a Medicare Beneficiary ID. It's 11 digits. It'll be on that red, white, and blue card that you have. That's a card that you want to keep safe, but not necessarily be presenting at the pharmacy or the hospital or the doctor's office. Once you're enrolled in the Medicare Part D plan, you'll receive an explanation of benefits every month. It's referred to as an EOB. People will talk about them quite frequently. It's sent monthly following any prescription benefit activity. So you'll get it in the mail, and you can review it to make sure that it matches up with the experience you're having there at the pharmacy. It is available online. If you choose not to get it in the mail every month, you can get onto your online profile with Express Scripts and opt out of that mailing, so that you don't have to get that piece of mail every month, and you can just monitor it online. It is once monthly. It cannot be changed to a quarterly thing or a yearly thing. It is by Medicare rules. It has to be provided once a month to the patient. Medicare does have late enrollment penalties. That's if, say, you're eligible for Medicare and you don't enroll, and you just have no coverage. For every month that you don't have coverage, you pay 1% of the standard Medicare D premium. And you'll receive a letter from Express Scripts, and that'll be tacked onto your premiums. Say, for example, you're an employee that works till you're 70. So you were eligible for Medicare from 65 to 70. When you retire at 70 and you apply for Medicare, you'll get a notice saying you'll have a late enrollment penalty. That's accumulation of those 5 years. You can reach out to us, and we can provide to you what's called a letter of attestation, and we'll provide that to Express Scripts, letting them know that you had credible coverage for those 5 years, that while you were over 65, you were still working, covered on a commercial plan, and you won't be responsible for that late enrollment penalty. And that is, of course, if you were covered on UK's plan. So there's also a function of Medicare Part D. It's called IRMA. It's an income-related monthly adjustment amounts. It's paid directly to the Social Security Administration. And this is based on your mean adjusted gross income. It's based on your previous years. They'll go back 2 years if your most recent isn't available. And it's really kind of an adjustment based on what your income is, how much your IRMA penalty would be from, what you're based on income. Now, these can be challenged if, say, when you retire, your income is going to be significantly different than it was the year before in a lot of people's cases. So what you can do is you can challenge that and provide information to Social Security and Express Scripts to show that your income is not going to be that same level, because they are looking at previous years when you were a working employee as opposed to a retiree. But these are just some of the numbers. These are not final for 2021 yet. These are just projections that we've received, and just kind of giving you an idea of what numbers to expect. On the opposite end of that, there is a low income subsidy, kind of an extra help on Medicare Part D. It's a monthly premium reimbursement that you can get. It's reduced copays on prescriptions, to help out at the pharmacy, kind of at that point of sale more so than just the premium reimbursement. You can qualify based on certain levels of income yearly. In 2019, it was $18,735, and a little bit higher for married couples. And it also depends on the resources you have, including bank accounts, stocks, bonds. It doesn't include your home or your car or any sort of life insurance policies that you have. So there's more information at this website that you can go to, and it can provide more information about the low income subsidy. If you think that it's something that you would qualify for and you would benefit from, definitely look into that. Another thing we want to talk about is if for any reason you ever have to go to the hospital. We've been seeing this kind of over the past 4 to 5 years. It's a adverse side effect from some changes in Medicare and whatnot. And when patients go to the hospital, you can either be admitted or under observation. And from my experience, it doesn't seem to be that there's any rhyme or reason of why somebody would be admitted over observation. If it's a serious situation that a patient's admitted for weeks at a time, it's pretty obvious. But in some cases, even knee or hip replacements, we see patients going in, they're just under observation, and they get their medications, just the normal everyday maintenance medications while they're in the hospital. But because it's considered an observation and they're not admitted, then Medicare Part B does not cover any of those self-administered medications. So anything you take, like a tablet, patients get their eye drops sometimes while they're in there, their nasal sprays and allergy medications. This is something to keep track of and be mindful of if you ever do have to go to the hospital for anything, because Medicare B won't cover that if you're only under observation, and then the patient gets charged the full amount. And hospital charges for medications are much higher than what you would see at a pharmacy. We get claims for patients where it's $5 or $6 for even just a one Tylenol. So it's something to keep in mind. And what we can do is we take all of these itemized statements for patients and we help get them some partial reimbursement. It's never 100% reimbursement for what they owe to the hospital, but we do help get some of that identified. So if you're in the hospital and you're under observation, you're not admitted, and if you go a day without an eye drop or a nasal spray for your allergies, it may not be a big deal, and you're saving yourself some headache and some high costs there moving forward. And lastly, we do reach out to patients from our office frequently throughout the year. We look for claims of interest where the patient could be paying way too much money for a medication, and we reach out to them to let them know that lower costing options are available. Or when the new year turns around, we reach out to them to let them know a medication you're taking is no longer covered on Medicare, or there's new rules applying to that Medicare drug. We help walk patients through that and get ahead of the problem before they show up to the pharmacy and the cost is a whole lot different, or the medication is not covered. So you may be hearing from us. We do reach out to patients on a regular basis. On the screen now is a list of all the pharmacists that could be reaching out to you, as well as our contact information. If you have questions about a cost you paid for a medication at a pharmacy and you're not sure if it's appropriate, or you paid too much, or why it is what it is. Sometimes you just want to verify that the information you're getting from the pharmacist is correct at the point of sale. We're happy to verify any of that, go over costs of medications, or if you have questions about your drugs or drug interactions. It doesn't have to be just a financial driven conversation. We can definitely talk about medications as well. And I know that was pretty quick, and there's a lot of information. The slides will be provided and saved for distribution later. This whole presentation, narration along with it and everything. Like I said, that email address on there you can send with any questions you may have regarding the prescription benefit for retirees, whether it's pre-65 retiree, or you're going directly into Medicare from working, we'd be happy to answer any of those questions and provide you information about your medications. I have noticed that the chat's been pretty busy. I think Lucy's been answering everybody's questions as best she can. So I'm going to leave it open for a little bit longer for people to get a few questions in and go from there. But it's been a pleasure, and I hope to work with you all well, and happy retirement. So thank you so much for your time.